the main issue with the head and neck cancer patients treated with immunotherapy is that we know that immunotherapy works, but we don't know how to select the subgroup of patients who really take a great benefit from this treatment. This is the most compelling fact that we should give to our patient. So in order to find out which are the characteristics of this group of patients, we evaluated in a retrospective series 2 cohorts of patients. One cohort that we defined the long survivors, that are the patients reaching an overall survival greater than 18 months. That is really a huge overall survival for head and neck cancer patient treated with immunotherapy alone in a second-line setting. And on the other side, we evaluated a group of patients treated with the same therapy, but achieving a short overall survival that is less of 6 months, that is less than the median overall survival achieved in the registration trial for immunotherapy. So this is the selection. These are the selection criteria in which we evaluated our patients. And we performed gene expression analysis on the tissue samples that we obtained in these 2 cohorts of patients. Then we put this gene expression analysis on clusters of gene expression that we previously identified. And what we found out basically was the fact that the long overall survival group was the one with a gene expression profile called the immunocluster. So that we found out some characteristics in the tumors that could predict the fact that these patients are the ones obtaining the high benefit from that treatment. So basically, this was the criteria of the trial, of the idea of our trial. This mirrored what we already performed, I do think, about 8 to 10 years ago. In the same way, trying to identify a subgroup of patients who achieved a long-term response to chemo plus cetuximab. That is the treatment already still used in recurrent metastatic head and neck cancer, but that it was the state of the art for all the patients before the advent of immunotherapy. So what we found out is that the characteristics of the long-term survivors were quite different from the characteristic of the long-term survivors with cetuximab. So there are different gene expression profiles for long-term responders.